Will Trump's $50 billion rural health fund save struggling hospitals? Is a $50 billion investment in rural healthcare sufficient to address the pressing challenges faced by these communities? This question looms large as Congress allocates this substantial sum to support rural hospitals and medical providers, aiming to mitigate the anxiety surrounding the unprecedented cuts to federal healthcare funding that President Donald Trump enacted on Independence Day. But can this financial injection truly be a lifeline for the beleaguered rural healthcare system? Alan Morgan, the CEO of the National Rural Health Association, a non-profit organization focused on rural health policy, expressed his concerns, stating, "I have more questions than I have answers. No one has those answers yet." He pointed out that the new funding, which is set to be distributed over a 5-year period, pales in comparison to the staggering $155 billion in projected cuts to rural Medicaid funding over the next decade, as estimated by KFF, a nonprofit health policy research organization. The apprehension among experts, hospital administrators, and lawmakers from both political parties is palpable. They fear that Trump's legislation will disproportionately harm rural hospitals and clinics, which serve a significant number of patients reliant on Medicaid, the federal state health insurance program for low-income individuals. The new law proposes to slash over $1 trillion from Medicaid over the next 10 years, a move intended to finance tax cuts that primarily benefit wealthier Americans. The introduction of the $50 billion fund was a strategic maneuver by Republican leaders in Congress to secure the support of party members, who were initially hesitant to endorse such drastic reductions in Medicaid and other health services. In the Senate, this rural healthcare initiative played a crucial role in garnering votes, including that of Alaska's moderate Republican Senator Lisa Murkowski, who voiced her worries about the potential negative impact of the law on healthcare in her state. Notably, approximately 1 in 3 Alaskans relies on Medicaid for their health coverage. Jared Cosin, the president and CEO of the Alaska Hospital and Healthcare Association, expressed his deep frustration regarding the cuts to Medicaid funding, which he believes will have long-lasting repercussions for Alaskans. He criticized the approach taken by Republicans, suggesting that simply allocating funds without addressing the underlying issues is insufficient. "It's frustrating in the public realm when decisions like this are made fast and, frankly, carelessly," he remarked. "The consequences are going to fall on us, not them." The impact of the law's funding cuts will be particularly severe in 12 states with large rural populations that expanded Medicaid under the Affordable Care Act. These states, which include Illinois, Kentucky, Louisiana, Michigan, Minnesota, Missouri, New York, North Carolina, Ohio, Oklahoma, Pennsylvania, and Virginia, are expected to bear the brunt of the reductions, as highlighted by KFF. Some Republican lawmakers have hailed the $50 billion rural healthcare fund as a significant victory for health services. However, there remains considerable uncertainty regarding which hospitals, clinics, and providers will benefit from this funding and the extent of the financial support they will receive. The Rural Health Transformation Program is designed to allocate $10 billion annually from fiscal years 2026 through 2030. States must submit applications for their share of the funding by the end of this year, detailing how they plan to utilize the resources. The law specifies several potential uses for the funds, as analyzed by the Bipartisan Policy Center. Providing financial support to rural hospitals to maintain essential services, such as emergency care and labor and delivery. Recruiting and training healthcare professionals, including doctors and nurses, in rural areas. Enhancing emergency medical services, such as ambulances and EMTs. Implementing new technologies, including telehealth services. Offering treatment for opioid use disorders and mental health services. Improving preventive care and managing chronic diseases. Each year, Half of the $10 billion will be evenly distributed among the states that apply, while the remaining half will be allocated at the discretion of the administrator of the Federal Centers for Medicare and Medicaid Services, currently Dr. Mehmet Ounce, based on factors such as rural population and healthcare facilities. While this program does not fully compensate for the anticipated losses, Morgan believes it presents an opportunity to rethink the funding structure for rural healthcare. He advocates for giving states more flexibility in how they utilize the funds, emphasizing the importance of focusing on preventive care to keep rural communities healthy while ensuring that hospitals remain operational. If done correctly, it could really change the future course for rural America, Morgan stated, though he acknowledged the challenges involved in achieving this goal. Kentucky is projected to experience the most significant impact from the cuts to rural Medicaid funding, with an estimated loss of $12 billion over the next decade, according to KFF analysis. The state's Medicaid department is currently awaiting further federal guidance to understand the implications for its program. Kendra Steele, a spokesperson for the Kentucky Cabinet for Health and Family Services, noted, over 1.4 million Kentuckians rely on Medicaid, including half of all children in our state, seniors, and more vulnerable populations, and the passage of legislation on the federal level will have serious impacts for those individuals, rural healthcare, hospitals, and local economies. Even with the introduction of the new program, states nationwide will need to reassess their budgets in light of the cuts, according to Hemi Warson, Executive Director of the National Academy for State Health Policy, a nonpartisan organization that assists states in developing healthcare policies. Every region is slightly different, and there's not a one-size-fits-all approach, she explained. Hospital ownership varies, as do the types of services that are critical for the communities where they are located. They must explore innovative ways to deliver those services with fewer resources. Currently, over 44% of rural hospitals are operating at a loss, a higher percentage than the 35% of urban hospitals, as reported by KFF analysis of RAND hospital data. Before the bill's passage, Ounce sought to reassure U.S. House Republicans that even districts not classified as strictly rural could still benefit from the program. Pennsylvania Republican U.S. Representative Rob Bresnahan indicated that funds could start flowing to his district as early as next year, having met with Trump, Ounce, and others to secure commitments that hospitals in his area would have access to the funding. His district encompasses both suburban and rural regions, including the cities of Scranton and Wilkes-Barre. Although the legislation provides guidelines for determining which facilities or areas qualify as rural, Morgan anticipates a rush among lawmakers and providers to claim rural status in order to secure a share of the funding. That's going to be a huge issue, defining who's rural, he remarked. We are all rural at heart when it comes to money. What do you think? Is this funding enough to truly support rural healthcare, or is it merely a temporary fix? Share your thoughts in the comments. Rural health funding, $50 billion slush fund under scrutiny. A $50 billion rural health program, dubbed a slush fund, has sparked questions and skepticism. This last-minute addition to President Donald Trump's tax and spending law has left hospital and clinic leaders hopeful yet puzzled. The Rural Health Transformation Program plans to allocate $10 billion annually to states for 5 years starting in 2026. While this investment is seen as crucial for rural areas plagued by chronic diseases, premature deaths, and financial struggles, doubts linger about its effectiveness. Critics argue that the program may not adequately offset looming Medicaid cuts, raising concerns about its impact on rural health infrastructure. The political nature of the fund has also drawn criticism, with some questioning whether it truly prioritizes rural patients' needs. Despite the program's intentions to enhance rural healthcare, experts warn that it may fall short in addressing the broader challenges faced by rural communities. As states gear up to submit detailed plans for utilizing the funds, uncertainties persist regarding the program's implementation and reach. The debate surrounding the fund underscores the complex interplay between politics, healthcare funding, and the unique needs of rural populations. How do you think this fund will truly impact rural healthcare? Share your thoughts below.